Hello guys, this is Dr. Ajinkya here. So today I'll be discussing about the internal carotid artery. I'll be talking about the entire detailed version of the ICA. So to do that, I'll be having four headings under which I'll be explaining the ICA to you guys. So the first heading is the clinical and the surgical anatomy, wherein I'll be talking about the origin, its different segments, different branches from each segment, and the termination of the internal carotid artery in the brain as anterior and middle cerebral artery. So that's the first point. Second point is that I'll be talking about how the internal carotid artery actually looks like on an arteriography, that to a real-time arteriography. So if you have a look over here, you can see the internal carotid artery on an arteriography. This is also called as a digital subtraction angiography in a real time. So there you can see the internal carotid artery. So that's the second point. The third point is that I'll be talking about the internal carotid artery on the MRI. So how on the MRI you can locate and trace the entire pathway of the internal carotid artery right from its origin to its termination in the brain as MCA and ACA. So also the fourth point is that I'll be telling you guys, or I'll be showing you guys how you can locate the artery on a CT scan, also on a CT angio. So on a CT angio, its entire length of the carotid artery I'll be explaining in brief detail. So let's begin, guys. The very first point was the clinical and the surgical anatomy. Now to understand that, as you can see in front of you, this is the diagram of the arch of aorta. So that you can see, that's the ascending, that's the arch of aorta, that's the descending aorta. On the left side, as you can see, this is the left subclavian artery, and this is the left common carotid artery. Now, it's an interesting fact that on the left side, these two arteries arise independently, okay, directly from the arch of aorta. Whereas these two on the right side, they do not origin from the arch of aorta, but actually a branch of the arch of aorta, that's the brachiocephalic artery, the innominate artery. So as you can see over here, this is the most common variation in the human population. So you have to remember this. That's the right common carotid, that's the left common carotid, right subclavian, the left subclavian. So this is the most common variation of the arch of aorta and its branching. So if you want to know about the different variations in the anatomy, you can go through this photograph over here where it shows all the different variations. Now there are total 8 types of anatomic variations. The very first one, as you can see over here, is the one I just explained some time back. That's the most common variation. That's the second, third, fourth, fifth, sixth, seventh, and the 8th variation. So on the CT scan or the MRI or the angiography, we have to locate the origin of the internal carotid artery, the common carotid artery, and know for sure if there's any anatomic variation. So you guys can take a screenshot of this and study in detail. So we should know that about 85 to 90% of variations this is the commonest variation you can see in the human population. So moving on to the next photograph, as we can see over here. Now, this is a diagrammatic representation of the entire length of the internal carotid artery. So just imagine a person is standing in front of you and that person is looking at you. So that would be a coronal section. So many surgeons, the skull base and the neurosurgeons, that's the ENTs and the neurosurgeons, they operate in the coronal field. So this photograph which you're seeing here is in a coronal section. So this is the entire length of the carotid artery along with its course and the anterior posterior deviation and turns. So imagine this is a coronal front view and this one being a lateral view, that's the sagittal view. So imagine a person you're seeing in front of you and that person is looking at an angle of 90 degrees to yours. So this is how the internal carotid artery looks like on a sagittal scan, and this is how the internal carotid artery looks like on a coronal scan. So just remember the simple fact that the internal carotid artery divides itself into 7 segments. So anatomically, the internal carotid artery has got 7 segments. So the very first one, as you can see over here in the yellow, is a C1. Then C2, C3, C4, C5, C6, and C7. So the C1 is the cervical segment. That's the segment of the ICA you see in the neck. And that's the C2 in the brown. Now, as you can see over here, the gray lines over here represent the petrous bone. That's the petrous part of the temporal bone. That's the deeper part of it. So it runs within the carotid canal in the petrous part of temporal bone. So you can see that's the C2, then that's the C3 in the fluorescent green. Now that part represents the lateral part. That's the part of the carotid artery which is running above the foramen lacerum and not through it. Remember that the internal carotid artery, after leaving the petrous bone, does not pass through the foramen lacerum, but it passes above or at the superior level of the foramen lacerum. Okay, so after that lateral part, we have the C4 over here. So as you can see over here, this is the blue version. That's the cavernous part of the internal carotid artery. Now, this part of the carotid artery in the cavernous sinus is also called as the carotid siphon because of its S-shaped curvature. Now, above the cavernous part, you have a very small segment which is also called as the clinoidal segment because it is lying at the level of the clinoid process. That's C5. Then we have this C6. Now, the C5 segment, which you can see over here, is extending from the proximal dural ring. Now I'll show it to you in a detailed anatomical version, but just for your knowledge sake, I'll just tell you right now, this is the proximal dural ring and that's the distal dural ring. These dural rings are nothing but the reflections of the oculomotor nerve, the dura. So that's the distal and the proximal dural ring. So this is the C6, which is nothing but the actual intradural part. So all these parts for extradural. The C6 becomes the intradural part, which is also called as the ophthalmic part, and the C7, which is the intracranial part, that is which goes inside the brain, actual brain. That's the C7, also called as the communicating part. So this is the part which divides into the terminal branches, as you can see over here. Now, this is a front view, so you can see that anterior cerebral artery goes medial and above superiorly, and the middle cerebral artery over here, as you can see, it goes laterally and behind. Okay, so that's a rough estimate of the course of the internal carotid artery in a front view or a coronal section. So this is how exactly the carotid artery, internal carotid artery, will look like on the CT and the MRI scans. So moving forward to the lateral aspect. So in the front view, you can appreciate the carotid artery, having a lateral to the medial course. And in the sagittal or the lateral view, you can appreciate that the internal carotid artery is having a posterior to the anterior course. So as you can see, this is the ACA, which is going superiorly and above and front, and the MCA is going laterally and behind. So these are the rough estimates of the internal carotid artery pathway. So if we move on to the next slide, you can see the same diagram which I showed you in a front view. That's the same diagram which is depicted over here. Okay, so that's the cervical part, that is the petrous part. Now this is a temporal bone, and that's the petrous part of the temporal bone. So that's the petrous part of temporal bone. As soon as it exits, there's a small segment over here which is the lateral segment. Then there's the cavernous segment over here. Okay, so you can see that's the cavernous segment. Then you can see the dural ring over here. Then we have the clinoidal segment, the ophthalmic segment, and the terminal C7 communicating segment. So that's the actual representation of the diagram which I just showed you over here. So you can refer this one to this one, comparing the anatomy of the petrous part of the temporal bone. So moving on further, now this was just a rough estimate of the pathway of the carotid artery and its segments. So if you go over here, now this is yet another diagram which shows the relationship of the pathway of the internal carotid artery and the termination of it into the ACA and the MCA. So this is a case of a right-sided ICA. So you can see this is a petrous part over here. That's the sphenoidal part. That's the cavernous part. then the clinoidal part, then the terminal part, that is the MCA and the ACA. So you can have a close-up view with the relation of the internal carotid artery along with the bony landmarks. So moving on further, now the very first part I'll be talking about is the cervical part. Now there are a few things which you should know of the cervical part of the internal carotid artery. Now the first point, the cervical part of the ICA does not have any branches. You cannot see any branches of the ICA in the neck. So as you can see over here, this is a right side of the neck. It's the sagittal section, right side. And what you can see over here is the brachiocephalic trunk. That's the brachiocephalic artery. And this is the right common carotid arising from the brachiocephalic trunk. And posterior to it, you can see the subclavian artery over here. So the subclavian artery and the common carotid artery from the brachiocephalic trunk, and vertebral artery arising from the subclavian artery. So vertebral artery is a branch of the subclavian artery which runs posterior to the common carotid and the internal carotid in the transverse foramina of the cervical vertebrae. So this is very important to understand, because this vertebral artery is eventually going to form the posterior circle of Willis, and which unites to the anterior circle of Willis in the MCA and the ACA. So that's the cervical segment. Now at the level of the upper border of the thyroid cartilage, as you can see over here, the common carotid artery bifurcates into the ECA and the ICA. Now that's the upper border of the thyroid cartilage. The vertebral level is the intervertebral disc between the C3 and the C4 is the level for the bifurcation of the carotid artery. So it is very important to understand the basic anatomy at the level of bifurcation. Now as you can see over here, just above the level of bifurcation and just at the lowermost region of the internal carotid artery, you can see a dilatation over here. Now that's the area of the carotid sinus, also called as the carotid bulb. Now this consists of the baroreceptors, that's the pressure receptors. So if you have a pressure, external pressure on this area, and if the baroreceptors get stimulated, it will result into bradycardia and a fall in blood pressure. So that in case of a supraventricular tachycardia, we give a carotid sinus massage so that the blood so that the heart rate comes down, so it becomes back to normal. So in cases of a choke of neck, the patient suddenly collapses is because of the rapid fall of the blood pressure and cut off the blood supply to the brain. So that results in the patient being knocked out. So that's the significance of the carotid sinus, as you can see over here. Okay, so the tunica media in this region is kind of thin, but the tunica adventitia, that's the outermost layer, is kind of thick. So that's the anatomy of the carotid sinus. Now as you can see over here, a small oval reddish brown colored structure, as you can see over here, this is called as the carotid body, and this consists of a lot of chemoreceptors. So whenever there is a metabolic change or a decrease in the oxygen level, this chemoreceptors in the carotid body gets stimulated. So that is a chemoreceptor, and here is a baroreceptor. So this you should be knowing in detail. So that was the anatomy of the sinus and the carotid body. Now moving up, you can see this is the internal carotid artery. Now this internal carotid artery, the cervical part, lies in front of the transverse process of the first three cervical vertebrae, as you can see over here, first, second and third. Also, now at the origin of the internal carotid artery, it directly ascends vertically up superiorly, and it runs along with the internal jugular vein and the vagus nerve within the carotid sheath. Now as you can see over here, this is a cut section of the neck. The internal carotid artery over here is covered with the sternocleidomastoid, the platysma, the integument, the deep fascia. Now the carotid sheath is nothing but the continuation of the deep fascia of the neck. So I will show you on this cam. Yeah, this is the carotid sheath area, which encloses the internal jugular vein, which is always lateral, the internal carotid artery, which is always medial, and the vagus nerve, which is always in between the two but on a posterior aspect, as you can see over here. So lateral is the vein, medial is the artery, and posterior is the vagus nerve. Okay, so that is all about the cervical segment of the internal carotid artery. So if on a axial section of the CT or the MRI scan, if you're seeing the artery, the internal carotid artery is always posterior medial to the external carotid artery. So that's one point you have to remember. So now if any MBBS student is watching this video, this question is very important for them. So a lot of times short notes come asking you guys to write for the relationship of the cervical segment of the internal carotid artery. So just have to write the anterior, the posterior, the medial, and the lateral relationships. So remember, in short, the anterior relationships are the parotid gland, the digastric muscle, the external carotid artery, the stylohyoid muscle, the posterior belly of digastric, the sternocleidomastoid. So basically, all these structures which you see in the front are the anterior relations. All these structures which you see in the posterior aspect are the posterior relations. That is the longus capacis, the superior laryngeal nerve, the superior cervical sympathetic ganglion. All these structures lie posterior. Okay, the medial relation is the pharynx, and the lateral relation is the internal jugular vein. So that's a short note right there. You can draw this diagram, say all the 4 relations, and that's it. That's your short note right there. So that was the cervical segment of the internal carotid artery. Now moving on to the second segment, which is a very important segment. Now, as you can see over here, this is a right side ICA. Now, this internal carotid artery always enters the base of the skull, that's the undersurface of the skull, through the external opening of the carotid canal. So as you can see over here, the artery is entering into the skull through the external opening of the carotid canal, and that's the external carotid artery. That's the V3 through the foramen ovale, and that's the internal jugular vein through the jugular foramen. So that's the undersurface of the skull, and that's the left side which you are seeing right here, and that's the carotid canal. Now many PG students, final year students of neurosurgeons, skull-based surgeons, ENT surgeons, in case of MBBS students, for first year students, they always get asked this question about enumerate the various skull base openings and the contents within. So as you can see over here, this is a huge foramen magnum, and this you can see over here is the carotid canal. Now I'll explain you the contents and the openings as well. So as you can see over here, the huge opening in the center is the foramen magnum. Now these two, as you can see over here, these two flat presses are the occipital condyles, and directly below the occipital condyle is the condylar canal. So this is of utmost significance because the spinal cord passes through this, and if you keep in the midline along in between the occipital condyles, the next foramen which you can see over here is the foramen lacerum. Okay, so right above the foramen or the occipital condyle, you'll see the foramen lacerum over here, and this is the foramen lacerum, and just below and lateral to the foramen lacerum you can see the carotid canal. As you can see over here, that's the carotid canal. Okay, and this is the foramen ovale, that's the foramen spinosum, and all these foramens which are of utmost importance you have to know about. So these are basic important foramens which you should remember. So similarly, we were seeing this over here. That's the carotid canal, that's the foramen lacerum, that's the foramen ovale, that's the foramen spinosum. Now that's the condylar foramen, that's the occipital condyle, and that's the styloid process. So it's very easy if you try to remember that in this way. So the second part which we were talking about, as soon as it enters the carotid canal, is the Petrous part of temporal bone. Now to make it short, now this is a front view of the Petrous part of the temporal bone and the carotid artery. Now the Petrous part has 3 segments, as you can see over here in the very first diagram which I showed. Now this is the Petrous part which is running in the bone. It has got 3 parts. The short ascending segment, you can see the turn, which is also called as a genu. That's the second part, and the third part, which is the horizontal segment over here, right over here. So this is the vertical, that's the genu, and that's the horizontal segment. So three parts in the Petrous part of the ICA, which you have to remember. Now 3 to 4 important points are there in this segment. Now as soon as it enters into the carotid canal, it is in relation to the tympanic cavity and the cochlea, which is posterior in the initial part. So the artery lies anterior to the tympanic cavity and the cochlea. So as it goes above and turns, it forms a genu and becomes the horizontal segment right over here. This horizontal segment is separated from this area. Now this area above is the area of the trigeminal ganglion. As you can see over here, this was the vertical segment, and this is a genu, and that's the horizontal segment. So above this is, you can see, is the trigeminal ganglion, which is also called as the Gazerian ganglion. So these two are separated by a thin bony canal, which you can see right over here. That's the thin bony canal. Now sometimes it is not even present. So if it is not present, these two are separated by the fibrous connective tissue. Okay, so you have to remember the relations here. The tympanic cavity and the cochlea is posterior. As it goes horizontal, you get superiorly the Gazerian ganglion, which is a trigeminal ganglion, and they are in between the two, there is a bone, thin plate of bone. Now the carotid artery over here is separated from the thin plate of bone by the help of dura. So there's a thin layer of dura in this segment, which covers the internal carotid artery. Also, you can see a lot of sympathetic plexus, a lot of veins are present, which covers the carotid artery in this segment. Now, whenever you're dealing with the Petrous part of the ICA, that's the internal carotid artery, you always have to remember the relationship of the Vidian nerve. Now, whenever a skull-based surgeon, ENT surgeon, or the neurosurgeon wants to operate in the Petrous part, or the most terminal part of the Petrous aspect, they always encounter, if they want to locate the internal carotid artery, they first locate the Vidian nerve, because as soon as the horizontal segment of the Petrous part of the ICA ends, it becomes the foramen laceral part, and it ascends vertically upwards in the initial part of the sphenoid sinus. Okay, so at that very moment, you can see the Vidian nerve crossing the carotid artery and going laterally. Okay, so that is the indication of the Vidian nerve to locate the internal carotid artery. Now you should also remember how the Vidian nerve actually is formed. Now the Vidian nerve is formed by the union of two nerves, which is the greater superficial petrosal nerve and the deep petrosal nerve. Now the greater superficial petrosal nerve is a branch of the facial nerve. It carries the preganglionic, now remember, it carries the preganglionic parasympathetic nerve signals. Okay, that's first very important point. And the deep petrosal nerve, it is actually a branch of the sympathetic plexus of the ICA over here. As you can see, it is arising from the sympathetic plexus of the ICA, and it unites with the greater superficial petrosal nerve at the most initial part of the Vidian canal. As you can see over here, this is a Vidian canal right here. That's also called as the pterygoid canal, and it forms a Vidian nerve over here. This Vidian nerve enters the Vidian canal and joins the pterygopalatine ganglion, also called as the sphenopalatine ganglion. So that's a very important point you guys always have to remember. Now that was the first and the second part of the internal carotid artery. Now moving on to the third part. Now this is also a diagrammatic representation of the Petrous part of the temporal bone with the sympathetic plexus of the ICA. So a question you all have to remember is that where exactly is the sympathetic plexus of the ICA? It is definitely in the Petrous part of the temporal bone. Also extends into the cavernous sinus as well. So moving on to the third part of the internal carotid artery. Now this is the image of the endoscopic surgery which a skull-based surgeon, that is an ENT surgeon, and a neurosurgeon will encounter when they are operating in the sphenoid sinus. Now this is a sphenoid sinus. Okay, as you can see over here below, these two, this is the paraclival carotid. So as you can see over here in the very first image which I show you guys, Now, this was the lateral part which travels above the superior aspect of the foramen lacerum, and as soon as it enters into the sphenoid sinus, it has a vertical course. Okay, it has a vertical course, then it turns horizontally, forming a posterior genu first, then that's the horizontal segment. It turns again medially and anteriorly, forming the anterior genu. So the internal carotid artery in the sphenoid sinus has how many parts? One short vertical process. So this is the cavernous part right here, and this is the paraclival part in the sphenoid sinus right here. Okay, so the paraclival part, the short vertical cavernous part, the posterior genu, the horizontal part, and the anterior genu. Okay, so these are the parts of the cavernous and the paraclival internal carotid artery. Now, going back to the endoscopic picture of the artery, you can see this was the paraclival vertical. This is the entire clivus over here. That's the paraclival carotid artery. Now, this is the pituitary gland right over here. That's the optic nerve. That's the internal carotid artery superior part on both sides, and that's the pituitary gland right here behind the bone. So the paraclival carotid will ascend directly upwards vertically, and as soon as the floor of the sella, that's the pituitary gland, arrives, there is this inferior intercavernous sinus. Now there's a cavernous sinus over here, there's a cavernous sinus over here. So these two cavernous sinuses interact with each other through the superior intercavernous sinus and the inferior intercavernous sinus. So at the level of the inferior intercavernous sinus, this carotid artery takes a turn right here like this. I'll show you right here. This was the paraclival carotid artery. So that's the short segment of the vertical cavernous carotid. So this is a pituitary gland right here. Now the bone has been removed, the dura has been removed. This is the pituitary gland lower border. That's the ascending paraclival, which I showed here. That's the paraclival. So same, that's the paraclival. Now this is left side and this is right side. So this is the ascending segment of the cavernous carotid. The CCA stands for the cavernous carotid vertical portion. As soon as we arrive on the lower border of the pituitary gland, it takes a turn anteriorly and laterally. This is forming the posterior genu right here. So this is the horizontal cavernous carotid, and then it turns again anteriorly and superiorly to form the anterior genu. So a turn is nothing but a genu. So we have a short vertical segment, a posterior genu, a horizontal segment, and one anterior genu. So this part of the carotid makes up the cavernous carotid, and this is the paraclival carotid. And as you can see over here, that's the median nerve which I was talking about, and which crosses the lateral segment, which is right over here. So once you locate the median nerve, you locate the internal carotid artery. So that's the cavernous carotid. And in the next segment, now you can see the same photograph. That's the cavernous carotid. If we extend that above, we can see an ophthalmic artery coming here. So up till here was the cavernous carotid. This was up till here was the cavernous carotid, the clinoid process. So that's the clinoidal part of the carotid artery. And above that, once you enter the dura, the intradural part is the ophthalmic segment above, and which is giving a ophthalmic artery right over here, just below the optic nerve. Okay, so that was the cavernous segment, the clinoidal segment, and the supraclinoidal ophthalmic segment. Now, I'll be talking about the intracranial communicating, that's the terminal segment of the carotid artery in some time. So as you can see on a sagittal scan, this was the brachiocephalic artery giving rise to the common carotid, then the internal carotid. This is a vertebral artery. So this vertebral artery goes behind, comes anterior, and this is the internal carotid artery dividing into the ACA and the MCA, and this is the circle of Willis being formed over here. Same picture you can see over here. That's the circle of Willis. That's the vertebral artery. Now, yes. Now coming on to the C7, that's the terminal segment of the internal carotid artery. Now, as you saw, we could see over here, this was the optic nerve. Okay, this was the optic nerve. This is the optic nerve. Now that's brain actually. This is brain. What you can see over here, this is a dura mater, and above is brain. You can see the ophthalmic artery over here. That's the optic nerve right there. Now just remember this photograph and see this photograph. This is the optic nerve, that's the optic nerve, that's the optic chiasm. We were right here, this is the pituitary gland, that's the pituitary stalk. Now, above at this level, we can get the anterior cerebral artery and the posterior communicating and the posterior cerebral artery above the level of the pituitary gland. So this is the anterior cerebral artery, that's the anterior communicating artery, and these are the branches of the A2 segment of the anterior cerebral artery. That's the orbitofrontal, the frontopolar, and this is the recurrent artery of the Hubner. And you can see the superior hypophyseal artery right here. That's a branch of the ophthalmic segment along with the ophthalmic artery. So if you refer to this diagram over here, we saw the optic nerve. Okay, we saw the optic nerve, and we could see the internal carotid artery. Okay, this is the internal carotid artery right here. That's the internal carotid, that's the optic nerve, and this internal carotid behind the level of the optic nerve divides or terminates into the ACA, that's the ACA, and that's the MCA, that's the ACA, and that's the MCA. So the ACA is further divided into the A1, the A2, then A3, A4, A5, which I'll show you on the arteriography as well. So that's the pituitary gland and that's the pituitary stalk. So this is how the cerebral part of the ACA and the MCA is formed, and they divide into three branches. The ACA, that's the recurrent artery of the Hubner, that's the orbitofrontal artery, and that's the frontopolar artery. So moving on to the next thing. Now, the final thing which you need to understand in the clinical and surgical anatomy is the branches of the internal carotid artery in each segment. Okay, so in each segment you can see these branches arising. So the C1, as I said, which is the cervical part, has apparently got no branches at all. Only the external carotid artery has got branches in the neck. So simple. So just remember like this: C1 has no branches, C2 has branches, C3 has no branches, C4 has branches, C5 has no branches. So an alternate number does not have branches. So C1 no branches, C3 no branches, C5 no branches. Whereas C2 has two branches, C4 has two main trunks, C6 has two main arteries, and here C7 is the terminal branch, so it terminates into the ACA and the MCA along with the anterior choroidal artery and the posterior communicating artery. So you can take a screenshot of this photograph. So the Petrous part of the internal carotid artery has got two branches. One you can see over here is the carotico-tympanic, and the one over here is the Vidian artery. Now the carotico-tympanic is the branch which goes and joins to the anterior tympanic artery in the tympanic cavity, as I showed you some time back, the tympanic cavity, and the anterior tympanic branch is from the maxillary and the stylomastoid artery. So this is the fate of the artery from this side. The other artery is the Vidian artery. Now this Vidian artery follows the Vidian nerve in the Vidian canal. Okay, so that's the Vidian artery over here. As we move up, C3 has no branches. C4 is the cavernous part of the internal carotid artery. Now this is the most important thing which you have to remember. Now it has got two main trunks of arteries. This trunk on the medial aspect is the meningohypophyseal trunk, and the one on the lateral aspect is the inferior lateral trunk. This is called as the inferior lateral trunk, and this is called as the meningohypophyseal trunk. Now, the meningohypophyseal trunk has three branches. The inferior hypophyseal artery, which supplies the pituitary gland's posterior aspect. That's the posterior part of the pituitary gland. Okay. Also, you can see the artery as dorsal meningeal artery. This dorsal meningeal artery, along with the meningeal branch of the posterior ethmoidal artery, supplies the dura of the anterior cranial fossa. Now you can see over here the tentorial artery. Now this tentorial artery is also called as the Italian artery, and that Italian artery is also called as the Bernasconi-Casinari artery, which supplies the proximal and the middle portion of the third nerve and the fourth nerve along with the cavernous sinus, lateral wall, and the tentorial edge. Okay, so these are the three main branches of the meningohypophyseal trunk. Okay, so moving on to the second trunk is the inferior lateral trunk. Now there are four branches. One branch is the proximal superior branch. Okay, the other one is the branch passing through the superior orbital fissure. The third is the branch which supplies and passes through the foramen rotundum, and the fourth one which is passing through the foramen ovale. So these are the four branches of the cavernous segment. C5, which is the clinoidal segment, has no branches. We move on further up ahead, which is the C6, also called as the supraclinoidal or the ophthalmic segment. It has got two main branches, okay? Only two main branches, and that is the ophthalmic artery, which we saw some time back over here. The ophthalmic artery. You can see this is the ophthalmic artery. It arises on the superior medial aspect and then turns laterally. Same here, you can see over here, that's the ophthalmic artery being arising from here. And the second one is the superior hypophyseal artery. The superior hypophyseal artery supplies the the anterior part of the pituitary gland, the hypothalamus, and the optic chiasm as well. Okay, so it supplies the optic chiasm undersurface as well, and the anterior part of the pituitary gland. So these two branches from the C6. Now coming on to the final part, which is the C7. Now we all know C7 terminates into the anterior cerebral artery and the middle cerebral artery. Okay, so also two more branches are given off. That is the at the C7 level is the anterior choroidal artery and the posterior communicating artery. Now the posterior communicating artery combines the posterior cerebral artery with the internal carotid artery. Now this is the one which forms the circle of Willis, the posterior communicating artery. The anterior choroidal artery is nothing but the branch from the C7 part. It supplies the lateral ventricle, it supplies the lateral ventricle, it supplies the lateral geniculate body, it crosses over the superior border of the optic tract, and it eventually supplies the choroid plexus, which forms the CSF in the lateral ventricle. And this is the ACA and this is the MCA. Okay, so this is a rough picture of the front view of the anterior and the posterior circle of Willis. That's the ICA, and with its curves, that's the vertebral artery forming the basilar and the circle of Willis over here. So you can take a screenshot of this and have a good look at this. So I have already explained in my another video how the circle of Willis is formed, so you can go and check it out later. So now coming on to the second most important point is the real-time arteriography. So as you can see over here, this is a real-time arteriography, and you can see this is the internal carotid artery. So a dye has been injected into the femoral artery, and a particular time is set and the injection is given, so that an X-ray is taken. So as you can see, this is a real-time arteriography.